Hello, you guys. This is Dr. TJ Watkins coming to you with another Pharmacy Corner. Come on, y'all. Let's pull up to the corner. So you've probably seen in recent news about a syndrome that is rapidly affecting children at an astonishing rate. Today with this Pharmacy Corner, we're going to talk a little bit about this syndrome, also kind of shed some light on it and debunk some of the things that we thought we knew about children and the coronavirus. So let's first start off with the name. The syndrome is called multi-system inflammatory syndrome in children, also known as MIS-C. And we're going to take a look here at the most accurate information I could find, which is found on the CDC's website. So multi-system inflammatory syndrome, also known as MIS-C, is an inflammatory condition and response that a child has where all of their vital organs in their body become inflamed. That is their heart, their lungs, their kidneys, their eyes, even their stomach organs become inflamed and start to cause problems in their body. Now, as you know, this can be very, very severe for children. This can also affect adults. Now, I think it's important for us to have a reference point. And so we're going to take a look at the cases that we have here in the United States, because I know what you're thinking. MIS-C, I've never heard anything about this. I don't know what this is. Well, the first cases of MIS-C date all the way back to May of 2020. That's right, May of 2020. Back then, we didn't know a lot about coronavirus, and there's still some things we have to learn. But initially, we thought that this disease would not affect our children, that they were not at risk. And now we have over 2,600 cases of MIS-C and 33 deaths that can be contributed to MIS-C in children. That is very severe. This is no longer something that is rare. The children that are affected are between the ages of 1 and 14 with a mean age of about 9 years old. And look, 66% of the cases that are reported are minority children. That is Latino, Hispanic, and Black children are the ones who are likely to get this syndrome. And here is the link between coronavirus. 99% of the cases that we see, the children have a positive SARS-CoV-2 test, which basically means they had prior coronavirus infection or are currently infected with the coronavirus. And you can also see how it affects your territory. If we click right here on Virginia, we see the cases that we have here in the state of Virginia that we live in. So now we know the severity and the magnitude. What can parents really do? The CDC has a great section on their website that talks about, again, what MIS-C is, this condition where all of the child's vital organs and body parts are becoming inflamed. They also have some things that you should look out for if your child is sick. Does your child have a fever? Are they nauseous? Have they been vomiting? Do they have neck pain, stomach pain, diarrhea, rash, red eyes? Are they tired? If they have any of these symptoms, also coupled with some of the more severe symptoms, they need to immediately seek emergency care. You need to get them to the doctor immediately. This disease is very rapid in nature, and you don't have time to waste. If your child is having severe stomach pain, severe chest pain, trouble breathing, blue color or palish appearance because they're not getting enough oxygen, immediately get them to the care of a doctor. Some children even have to be in the ICU and have to be hospitalized. So get them to care immediately. Once they're in the care of the doctor, they're going to receive blood tests. The doctor's going to check their heart, their chest, their stomach. They're going to provide supportive care to them, making sure that they have antibiotics, medications for inflammation like steroids, and also make sure that your child is comfortable, that they have fluids so that they don't get dehydrated. But you must immediately get them to the doctor's care so that they can help you do what's best for your child. Now, it's unfortunate to admit, but we don't know a lot about MIS-C. We're still learning a lot about it. We do know that what type of children it is affecting. We don't know why it is affecting these children, though. But what we do know is we have to debunk what we recently thought and were told, that Coronavirus was not a problem for children. Miss C is a complication for children. So that is not true. What can you do to protect your children? Still do what you've been doing. If they're over the age of 2, have them to wear a mask. Keep them social distance. Make sure they're washing their hands. Explain the importance of these things to them. But for now, just make sure that you stay informed, stay educated, and stay vigilant. This is Dr. TJ Watkins. Please, you guys, be safe and be blessed.